Nehal Parikh is the Director, Advanced Therapeutics and Childhood Solid Tumor Programs, and Assistant Professor of Pediatrics at Connecticut Children's Hospital, and he's going to give us an update on our TPI-287 trials. Last one? Oh, thank you. Vista. So this one does work, by the way. Just press the star button. Oh, it's pretty light. Andre, can we keep using yours? Yours is actually better. Okay, we have one, but we'll keep, and I promise we won't lose it.
Hi, good morning, thank you, and I will try to make this quick. So let's see. So, as most of you know, TPI-287 is a taxane-based agent. It's a novel antimicrotubule agent. One of the nice features of this drug, because of the side chain modification, is that it enhances its ability to get into the brain. As we know, recently we're seeing an increasing pattern of CNS relapses with neuroblastoma. So this drug offers us that ability for treatment within that system. The Bactin ring structure modification allows for circumventing the MDR-based resistance that neuroblastomas tend to have, and allows for better binding of the mutant tubulin, thereby stabilizing that tubulin and perhaps decreasing the ability of tumor cells to progress. So our rationale was based on adult and pediatric cell line data that Giselle had done a few years ago, where they used cell viability assays and cell line activity data in neuroblastoma specifically, and then subsequently moved on to in vivo mouse models to show response. I don't have graphs to show that data, but that's summarized based right here. Taxanes traditionally have been poor. We haven't used taxane-based drugs in pediatrics because of the activity, but because of the changes of the side chain and Bactin structure, we feel that it enhances activity in solid tumors, and particularly in neuroblastoma. Risks of this drug, as like many other microtubule inhibitors and microtubule binding drugs, is neuropathy. We tend to see neuropathy in many of our patients, although mild in nature. And then occasionally, but not normally, it does affect cell lines, and we see mild decrease in white and red blood cells. Occasionally, patients have had fatigue, and diarrhea tends to be a common symptom. Although many of these features may be because patients have been treated with these types of agents for such a long period of time, so some of that exhaustion to their body systems. Less likely we see some nausea, vomiting issues, and occasionally cough, and typically GI bleeding is a rare event. So now I'll go through two trials that are up and running of NMTRC 004 and NMTRC 005 to give you a glimpse of where we are currently in terms of our enrolling and some of the changes that we have made. So our primary objective of this study is to really evaluate the safety of the new formulation of the TPI-287. And our phase 2 component on this trial is to look at the response rate. Our goal is to have 32 patients in each of the stratas and to look for overall response rate of 10% with 80% power. Our secondary objective is to look at progression-free survival and overall survival. And then also evaluate PK data, particularly in the phase 1 portion of the trial. And then quality of life measurements and pain scores. we really thought that this would be important in these early phase trials because one of the challenges in developing early phase trials is to show how it impacts patients. Quality of life in patients' day-to-day life is such an important part of putting children through these trials. So understanding that in these trials, we felt that it was important. Basically, it's 6 cycles of TPI-287 given on a weekly basis. It's a 21-day cycle, which is a compression from our previous TPI-287 study, and it's more in line with some of the Children's Oncology Group protocols that are out there looking at cycles for neuroblastoma therapy. Phase 1 will entail 6 patient cohorts, assess safety and tolerability of the new formulation, which has a lot less cremophore in hopes of decreasing sensitivity to that agent. And then phase 2 we'll start looking at each of the strata and measurable activity. Progress to date, we have 6 centers in our, I believe, 15, 16 NMTRC centers that have this trial open and running. So far, we've only enrolled 5 patients, I believe, 1 very recently. So this really is a very slow enrollment on this study, and it's understandable as some of these patients going through numerous trials, having to go through IV on a regimen on a weekly basis, it does tire them out. So it has been slow. Some of the amendments that we've made along the way is try to get a better handle on the toxicity data for this trial, some clarification and closer monitoring, particularly of coagulopathies on this trial. What we have seen in our early patient population is some changes in their liver enzyme, low platelet count, and low white count. Again, this may be due to bone marrow exhaustion from previous trials, but these are the things that we have noticed. NMTRC 005 is a phase 1, phase 2 trial where irinotecan temozolomide is compared to irinotecan TPI with TPI, irinotecan temozolomide with TPI in our relapse population. Again, it's 6 cycles, arm A, arm B. This we have maintained every 28-day cycle as the previous trial was. It's an open label, non-randomized trial for phase 1 component, which has recently finished. So we're in the phase 2 component of the trial. And phase 2 is the randomized portion of the trial, where you're either selected to be in arm A, where you get irinotecan temozolomide plus TPI-287, or just the temozolomide irinotecan. Should you progress on the arm A of the study, these patients are eligible to transfer over to arm B, which does include TPI-287. Similar objectives, safety analysis and toxicity, as well as looking at response rates. Here's a trial design, which as they enrolled these patients into arm A or arm B, the dose that we have decided to use is 125 on both milligrams per meter squared on both of these trials based on MTD of the previous trial, and the standard irinotecan and temozolomide dose per the COG protocols. Similar sites have been opened as the 004 study. There are several sites that are in progress, and hopefully we'll be able to open these trials, both of these trials up in these sites in the near future, and continue to look for other centers to open these trials so we could enroll more patients and try to understand whether or not this is a drug that will be helpful. Similar toxicity of cytopenias, anemia, low platelet counts, low white count, and liver dysfunction. So closer monitoring is what we have changed in amendments on this study as well. Thank you to everyone that's here, including all our parents that are supporting us, and I'm happy to take any questions.